Why doesn't your doctor understand hiatal hernia? This is number 3 in a 5-part series on hiatal hernia this week. But the thing I hear from new patients that I speak to is, why does my doctor keep telling me it's all in my head? Or why does my doctor keep telling me there's no way having a hiatal hernia could create all these symptoms like heart palpitations and panic attacks and shortness of breath and anxiety and insomnia? Why don't they get it? I keep being told that that's impossible. So the thing to appreciate is that in the medical model here in this country, it's very much about, as you probably have experienced if you've done too much in conventional medicine, is that there's the general practitioner and then there's all the different specialists. And so what happens is when you, let's start with the ER trip that so many people with hiatal hernia suffer with. They go to the ER, and of course, what's an emergency room tending to see? It's tending to see life and death kind of experiences. So if you go in going, I'm short of breath and my heart's beating out of my chest, of course, the very first thing they're going to do is check your heart, make sure you're not having a heart attack or a stroke, etc., and to save your life. And that's their job. That's what an emergency room is there for, and bless them for being there. They save lives all the time. But as soon as they do the EKG and they, check your blood pressure and, they do a number of different things and they go, listen, your heart's fine. There's nothing wrong with your heart. Great news, you're not having a heart attack. So that might settle you down a little bit, but you still have this shortness of breath. You still have this feeling of anxiety. And so now you're told you're just having a panic attack. That's all this is. And so, of course, you don't know why you're having a panic attack. You're not somebody who tends to get panic attacks. You're not even a panicky, anxious person, per se. Some patients say, yeah, I've had anxiety in the past, but other people say, I'm not an anxious person. I've never had a panic attack in my life. What's this about? We'll get into that in a moment, but sticking with the emergency room here, and then you leave the emergency room with a prescription for some sort of anti-anxiety medication. Very important when you're given prescriptions is to look at the side effects, and with these particular drugs, those side effects should scare you, and what you really want to do is get to the root cause. Now, maybe you're back to the emergency room because you have terrible shortness of breath and say, listen, you checked my heart before, you said it was fine, maybe you missed something, maybe there's something wrong with my lungs because I can't get a deep breath, and I just, I'm short of breath, et cetera, et cetera. So now they also add your lungs to the equation, only to tell you your lungs are fine, and then maybe recheck your heart, and again you're told your heart is fine and you're just having a panic attack. So you've done this maybe a couple of times and you're still miserable with a variety of symptoms, and maybe concurrently you're having the classic acid reflux, heartburn. So you decide to pursue the gastrointestinal route and see a GI doctor who sometimes will do an endoscopy, and that would be the moment, if your hiatal hernia happens to be acting up at that moment, see that you have a hiatal hernia. Usually it's small to moderate. Severe, you would be having more severe symptoms. And at that point, you are told, yes, you have a hiatal hernia. And then you ask the question, well, is that why I've been having these heart palpitations and panic attacks and shortness of breath, etc.? And then you'll be told, no, those things are not related. And so, you leave scratching your head going, wow, I guess I really am just anxious. I'm like, what's wrong with me? And then you start, having introspective thoughts, and that's not healthy, and analyzing why you're suddenly this anxious person when you never were before. So it's kind of a mess is what it is. And so even if you're told the hiatal hernia is present, you're absolutely not validated for having all these other symptoms as possibly related. And that is wrong, because they are related. And I see every age group, male, female, fit individuals, and couch potatoes, all across the spectrum, people suffering with this whose lives can be ruined. They can absolutely be ruined because they can't live the life they've always lived because of this syndrome, hiatal hernia syndrome. So it's missed because doctors are trained in boxes of, I'm a heart doctor, I'm a lung doctor, I'm a gastroenterologist, I'm a GI doctor, and never the twain shall meet. It's only in the ER that they might try to say, okay, you're not dying, thank goodness, and move on to the next patient, because that's what they're there for. Chris, if you guys were cheaper, then it would be worth it, or take insurance. I understand. Believe me, it's tough to run a business, and insurance doesn't pay for what we do. So that's the thing. So we're talking about the kind of testing that you do, and so you can have a blood test. They're not even as comprehensive as we like to do here. But the other test that we need to do, which is looking at the gut and looking at, as I like to say, who's home in the gut, meaning looking at the microbiome, and those are all the organisms, the microbes in your gut that's creating this inflammation that's forcing your stomach to be elevated. Tests like that, food sensitivity tests, working with a registered dietitian, these are not things that are covered by insurance. So back in the day, pre-Obamacare, insurance covered much better. Now it doesn't cover what we do at all. So I get it. And all you can do is make the decision for yourself if you're at a point where it is worth it to you to get the job done and not continue suffering or not continuing to be put on medication. And a scary thing that I'm seeing when patients keep going back to their doctor and saying, listen, my heart's beating out of my chest, and you say my heart's fine, how could it possibly be fine? And it's a legitimate question, certainly. And then they put you on a beta blocker to slow your heart rate. Then that's scary, because you don't need that. The heart rate elevation is secondary to the fact that stomach's in spasm. It's pushing up on the diaphragm, which is impacting where the heart is located, and then the heart starts palpitating to say, kind of, get out of my way. There's two reasons to the heart palpitations. One is literally that the diaphragm and stomach are getting in the way of the heart, and this Dr. Gupta from the United Kingdom, who is a cardiologist, stated this. But also the fact that because the diaphragm's a bit spasmed and it's not effortlessly bringing in air in and out, and it's bringing in less, the heart will start palpitating at a more rapid rate to bring more oxygenated blood. So it's a protective response. Ditto for the stress hormones being secreted. So you get this abundance of stress hormones that gives you this sense of kind of doom and anxiousness. And why is that? Because your nervous system is just trying to say, I don't know what's going on, but pay attention. It's like a smoke alarm going off. And it's just asking you to look around and pay attention, because you're not getting enough oxygen. And I want to speak to that. So wait, before I do. So it's a protective response, you see? So because you can't live very long without oxygen, and so your heart starts trying to bring more oxygenated blood, and your stress hormones are trying to get you into fight or flight, so you'll be alert to this problem. It's all a secondary response, but your body is trying to protect you, and it's trying to assist you. It doesn't feel very good when your heart's, you have heart palpitations and you're anxious at the same time. It feels terrible. Sometimes, you can feel like you're dying, for goodness sakes. But it is a protective mechanism of the body just to try to help and assist and get your attention. Now, one thing that happens a lot is somebody can be very short of breath. They go to the ER and they're told, your blood oxygen is perfect. There is no lack of oxygen in your blood. In your blood is the key point there, because your body is very sensitive to how much oxygen is in the blood, because there can't be much variation without you being quite sick. And we learned this during our pandemic, because people would go to the hospital when their blood oxygen had dipped, and then they could be on a ventilator, etc. So the body will do everything to keep that blood oxygen very, very stable within a narrow range. Now, that doesn't mean that when the diaphragm is in spasm, as we're describing, and you're short of breath, you're not legitimately short of breath. You are. You're having trouble getting a deep breath, but compensatorily, your body is also making sure that the blood oxygen is still fine. So you can have perfectly fine blood oxygen and still be feeling short of breath. I know that's a bit counterintuitive, but again, that's the truth of it. And it's again how strong this machine, the human body, is in keeping going and keeping certain factors very, very stable. So your doctor is not trained in hiatal hernia, although I must say, as our digestion has gotten worse and more hiatal hernias are starting to be found on endoscopy. So when you go to a gastroenterologist, more are found. All of a sudden, because I've been in practice for 40 years, we've been specializing with hiatal hernia syndrome for probably about 15. I only wrote the book a couple of years ago. That's my pattern. It takes me quite a while to write a book. But anyway, what happens is that the doctor is starting to see, the gastroenterologist is starting to see more of these hiatal hernias, and they're small, but hiatal hernia surgery centers have really exploded in the past 5 years across this country, and that's not a good thing. And why is it not a good thing? It sounds so easy. It's like, oh yeah, you've got this opening, we'll just do surgery, close it right back up. By the way, you'll never be able to vomit, which nobody likes to vomit, but if you really feel sick and you want to and feel the need to, you can't once they've altered your anatomy with this surgery. And the other thing is, remember, what is a hiatal hernia? It's that widening, that stomach's pushing up and widening that opening. All they're doing is closing that opening by wrapping the neck of your stomach around your esophagus. And sure, it's closing it, and you're not going to get reflexive, or I should say refluxive acid up into your esophagus as much, but does it do anything to get to the root cause of why you developed the heart palpitations and the panic attacks, and why your microbiome, remember those 38 trillion microbes in the gut, are out of balance, or why you're constipated? The root causes of hiatal hernia syndrome are not touched by surgery. So I keep meeting people, unfortunately, who have had the surgery and said, I am so sorry I did. It was a terrible recovery. First of all, it took a very, very long time. And it's like, I have all the same symptoms I had before, and I can't ever vomit. So they're not happy with it. Now, the stated success rate of the surgery is very high. What does success rate of surgery mean? You went in there to wrap the neck of the stomach around the esophagus, and there's other techniques as well, but a successful surgery is one that accomplished its goal. Mary, this was a success. What I, the surgeon, intended to do, I did. You're alive, and that was accomplished. That's success based on a surgeon's results, which is fair enough. But what does Mary care about? She and you care about what are your symptoms, and are they going to be alleviated by this problem? And even more importantly, if you have an unhealthy gut, which is what created this whole problem in 90+% of the time, maybe 95% plus of the time, that unhealthy gut is going to create other problems for you. So simply, getting this opening narrowed because you got surgery is not going to change any of that. And you're still going to have liver enzymes that are elevated. You're going to have small intestine that's not functioning and digesting and absorbing food the way it should. Your large intestine is full of microbes that are pro-inflammatory versus anti-inflammatory, on and on and on. So the surgery does nothing to fix that, unfortunately. So today's topic was, why did your doctor miss it? And in a nutshell, doctors aren't really looking for it unless they're gastroenterologists. And now, because all these surgery centers have popped up, I find patients with very small hiatal hernias who are being told, yeah, do the surgery, do the surgery, do the surgery. And I think that's disingenuous. I really do, because the success rate is not good, and it's not going to get to the root cause of the problem. Getting to the root cause is what we're going to talk about on Friday. But suffice to say that if you know somebody with these symptoms, so what are the big ones? Constipation, bloating, acid reflux, heartburn, heart palpitations, shortness of breath, panic attacks, feeling of anxiety, These are the big common ones. If you know anybody suffering with those, then definitely reach out, and we can do a consultation, really get an idea of how to get to the root of this. But the fact that all of those symptoms, which sound like they could have nothing to do with one another, are related is absolutely the case. And that's why doctors miss it, because they don't tend to look at the body as a whole. They're just looking at their area of expertise. And I can tell you that really no organ in the human body works in a vacuum. They're all interrelated. Now, I'm not saying if you need a type of surgery, it's not great to have that surgeon be expert just in that part of your body. That's great. But in these kind of inflammatory situations, looking at the body as a whole is really the only way to resolve it. So I'll see you tomorrow. I hope this was helpful. Please subscribe to the channel, share this with others, and we'll talk tomorrow.